AerVia Neonatal Supraglottic Airway Instructions for Use. This guide will walk you through the key steps for using the AerVia effectively and safely in neonatal patients. By offering a safer, more efficient, and less traumatic alternative to transitory endotracheal intubation, the AerVia has the potential to significantly improve patient outcomes and revolutionize the field of neonatal medicine. The AerVia comes in 4 different sizes for use in patients with different weights. Select appropriate AerVia size based on weight. After inspection, as necessary, lightly coat the anterior tip and posterior portion on the AerVia mask with water-based lubricant. Position infant supine with a shoulder roll in place, head midline, and in a sniffing position. Consider placing an OG tube if not already present. Aspirate gastric contents. OG can remain in place. Non-invasive respiratory support may remain in place if present, but may be removed if it interferes with placement of the AerVia. Once AerVia is quickly placed, ventilatory support can be resumed. Stabilize the tongue against the floor of the mouth. With dominant hand, insert the AerVia and advance along the hard palate of the mouth. Continue insertion until initial resistance is met as the mask is seated. If unable to advance into the posterior oropharynx, you may need to use the next smaller size AerVia. To secure the epiglottis within the holding pocket, push the AerVia device slightly inward until definitive resistance is met. This will allow the epiglottis to fall into the holding pocket. Pull the device back the same distance. This will keep the epiglottis up and away from the airway. Proper device placement can be verified by observing color change on an end-tidal carbon dioxide detector, auscultating for the presence of breath sounds, a prompt increase in heart rate, chest wall movement, or the presence of condensation in the tube. If the AerVia has been positioned incorrectly, remove and reinsert. If adequate ventilation is not achieved, you may need to use the next larger size AerVia. Connect to respiratory support using a mechanical ventilator, bag valve mask, or T-piece resuscitator. Provide positive pressure ventilation as needed. AerVia offers a simpler, easier, faster, and safer alternative to intubation during short surgical procedures or emergency resuscitation. After properly placing the AerVia, note level of depth insertion on the guide at the patient's lip. Affix AerVia to patient. AerVia can be removed when the patient establishes effective spontaneous respirations or short-term support from AerVia is no longer needed. If secretions are present, suction from the mouth and throat. Then, remove the AerVia by gently pulling back and slightly rotating the device until it exits the mouth. AerVia is a single-patient, single-use device. Dispose of properly following removal. Only trained medical personnel should use the AerVia. Before insertion, it is necessary that all medical professionals using supraglottic airways are familiar with precautions and indications found in the instructions for use. Supraglottic airways are not intended for chronic airway management. Please see full AerVia instructions for use. For more information on AerVia, please visit aervia.com.